Hello, and thank you for your interest in learning more about the Impact and Capacity Growth Initiative. I'm Shawn Brown, Program Officer with the Kansas Health Foundation, and today I'll be giving an overview of the RFP and providing some key points to consider when preparing your proposal submission. So let's get started. In developing the RFP, we had participation from program team members, some of whom you'll see listed here, to think about how to address health in Kansas through supporting nonprofits across the state. And the process involved program officers, our evaluation officer, our associate grants officer, grants associate, and of course, our VP for programs. So it was truly a team effort. The purpose today is to discuss KHF's mission, vision, and program areas, and provide background in how this initiative fits within KHF's strategic efforts. So this session is your opportunity to learn more about the details of the RFP and what the reviewers are looking for, and to get some questions clarified that you may have had, and it's our opportunity to connect. At KHF, our mission is to improve the health of all Kansans, and how we define health is in accordance with the World Health Organization's definition, in that it's an overall state of physical, economic, and social and spiritual well-being. And as we think about what really impacts health in Kansas, inherent in our thinking is the belief that all Kansans should be able to make healthy choices where they live, work, and play, and that access to health care, healthy, affordable foods, increasing physical activity, and reducing tobacco use is important to all Kansas communities. We also recognize that communities are unique, and they have assets and resources, and yet there are sometimes challenges to achieving full health potential for a community or population, and that is often the result of inequities in health. We also recognize that to accelerate health improvement in Kansas, there needed to be an intentional focus on health equity and eliminating health disparities. We further recognize we needed to continue to emphasize civic health by fostering civic engagement to ensure more Kansans become involved in efforts to strengthen communities and improve the health of the state. So to reflect these beliefs, we focused our efforts in two overarching program areas that guide KHF's work: health equity, with the goal to reduce health disparities related to social and economic factors, and civic health, with the goal to engage Kansans in improving the health of our state. Now, to ground us in common language, I'll share a couple of definitions and then talk about our focus areas and lift up a couple of examples. So the purpose of our health equity program area is to reduce health disparities related to social and economic factors, with a goal that by 2025 there will be a 10% reduction in health disparities between Kansas adults in at-risk and low-risk socioeconomic groups. So ultimately, it's to ensure that all Kansans have full and equal access to opportunities that enable them to lead healthy lives. KHF's Civic Health program area is focused on supporting efforts related to engaging more Kansans to improve the health of our state. So with the goal by 2025 that there will be an increased civic engagement among Kansans, with an emphasis on populations that experience the greatest health disparities. KHF agrees with the National Conference on Citizenship that civic health is really a measure of well-being for a community, state, or nation, and is determined by how actively citizens are engaged in their communities. And we typically see that a community with strong civic health is resilient, it has effective governance, and it's a better place to live. So when we look at health outcomes and health factors and policies and programs, according to some estimates, clinical care contributes only 20% to a person's ultimate health outcomes, quality of life, and length of life. And personal health behaviors account for another 30%. So that leaves a full 50% for the contribution of external factors such as social and economic factors and the physical environment. And these factors are largely outside of the control of an individual and really in the domain of community supports and public policy. So collectively, these are called the social determinants of health. Another way to look at it is with this graphic. The concept of social determinants recognizes the critical role of home, school, the workplace, neighborhood, and community in improving health. So social determinants are in part responsible for the unequal and avoidable differences in health status within and between communities. So individual and population health are affected by a range of personal, social, and economic and environmental factors. For example, people with a quality education, stable employment, safe homes and neighborhoods, and access to preventive services tend to be healthier throughout their lives. But we know not everyone has the same opportunities. So we see disparities, which are essentially differences. And these may be differences in race, ethnicity, geographic location, disability status, or a combination of any of these that are listed here. Now, to further illustrate this concept, I like this visual from Policy Link that describes two communities, and it's represented by a healthy tree and an unhealthy tree. And we know that when inequities are high and community assets are low, health outcomes are worse. But then when inequities are low and community assets are high, health outcomes are generally better. So the tree to the right represents healthy communities. And here you can see that the trunk represents the population behavior. So in these communities, there's a sense of community, strong social networks, and social support. And people are active in leadership, and they have political influence, and there are organizational networks that are in place. And then when you look at the roots, you'll see that they are expansive in the healthy neighborhoods. And these are the assets and the invisible privileges that people have without really thinking about it. So, here you see that the community is supported by quality schools and access to healthy foods and access to health care and a clean environment, and their transportation resources and health insurance and quality housing. And then if you look to the tree to the left, in the underserved community, people are experiencing many things at once. And those are represented in terms of substance abuse that's occurring. There may be violence, smoking, infant mortality, poor nutrition, obesity rates are higher. On the trunk on the left, you also see that there are fragmented systems, and there's powerlessness or a sense of powerlessness, disinvestment. Members may feel disconnected from one another. Again, the root system, when you look at it, is thinner in the unhealthy tree, and these are the community conditions that underlie the inequity that we see. Now, over in the healthy community, it doesn't mean that, what we may call opportunity-rich communities aren't dealing with STDs or substance abuse or poverty issues to a certain extent. They just aren't dominant because of the support systems and the overall health systems in place. And here's where the impact and capacity grants come in. We believe they play a key role in addressing these issues through policies, programs, and projects that support health. So we've chosen the impact areas to address specific issues such as how to increase access to health care, decrease tobacco use, increase physical activity, healthy food access, and improving civic health. So let's look at what's involved with the Impact and Capacity Grants Initiative. The Impact and Capacity Grants Initiative funds are for consideration of unsolicited requests that propose new, innovative policy systems or environmental change efforts that fit within KHF's 5 impact areas. And it's designed to enhance the organizational capacity of organizations to fulfill their missions as well. So impact grants must be new, innovative ideas that have not been undertaken before. So these are not recurring, ongoing efforts. I really want to stress this point, as this is one of the reasons an application could be declined, particularly when it comes to impact grants, and in some cases, capacity grants as well. For example, If you've been operating a food bank and in the past received a recognition grant to purchase healthy foods, and now you want to expand and open a food bank in another location, that would be considered an ongoing effort, and even though it's expansion. But on the other hand, if you create a model that was teaching clients of the food bank how to be entrepreneurs in the food ecosystem, and you're providing business coaches, and there's convenings that you're holding with the business community and other nonprofits in the process, in a bold, brand new idea that your organization has never undertaken before, that would be eligible. Something else to bear in mind is the importance given to policy efforts, and I'll talk a little bit more about that later. We're awarding up to $2 million annually, with $25,000 being the maximum grant award. The deadline is September 15th at 5 p.m., and the cycle remains open until that time. So the sooner you submit your application, the sooner you will have a decision as to whether your grant will be funded. And so we really do recommend early submission. With capacity grants, organizational capacity grants are internally focused efforts designed to help your organization fulfill its mission. For example, you may be interested in strengthening areas of diversification of funding streams or financial management. Relationships and collaboration may be important to you. Or maybe you want to strengthen your communication and marketing efforts or program services. You may be seeking to build up your membership base through collaboration and grassroots organizing. Or maybe you need to hold some convenings. Or you need to strengthen evaluation data and measurement systems. Or perhaps organizational planning such as leadership transitions and strategic planning might be needed. Or maybe you want to operationalize and enhance those capacities there. Also, I'd like to point out, organizations awarded capacity grants may have missions that address a variety of social determinants of health issues, such as, but not limited to, health, education, disability, housing. The point I want to emphasize here is that if you're submitting a capacity grant, the mission does not have to be related to one or more of the 5 impact areas. Now, with impact grants, again, I want to stress that these are not efforts that are ongoing, but need to be new and innovative. Externally focused efforts that relate to making progress in one or more of the 5 impact areas. And those are increasing access to health care, decreasing tobacco use, increasing physical activity, increasing healthy food access, and or improving civic engagement. Now, efforts may be focused on policy and systems change, advocacy work, including grassroots organizing. It might also be time-limited, objective-focused projects that build on evidence of what works, or you're seeking to test an innovative or promising approach. You might be looking to do initiative planning or ROI assessments, or maybe you're interested in initiative implementation and evaluation. Or maybe you need to request dollars to match an initiative, and you have projected committed funds lined up. Now, with policy, I just want to dig a little bit more deeply into that. In addition to looking for innovative new ideas, as I mentioned, we're also seeking to award efforts focused on policy for long-lasting change. Policy matters. Policy impacts economic, social, physical, and service environments. And, you know, I also want to think about that health in all policies is important. Policies not traditionally thought of as health policies, such as transportation, agriculture, land use, education, and economics. These all impact health and obesity rates. The other thing to consider is equity in all policies. Policies produce either positive or negative impacts on a community. So it's important to consider what are the ramifications of the policies of your organization and, you know, that you're seeking to address, and who's going to be impacted. Now that I've described what's eligible, let's talk a little bit about grant exclusion. Here you'll see a list of ineligible projects, which include the following. I just want to point out, with lobbying, we're talking about the introduction, enactment, or amendment of specific legislation and activities supporting candidates of political campaigns. With construction projects, that includes any items with permanent installation placement, including playground equipment, trails, building, and remodeling. And here you'll see a list of everything that's included, and for more details, you can visit our website. In terms of the review process, as we look at these grants, a review team evaluates all grant applications as they are received throughout the grant cycle. And grant decisions are made within a 45-day period. So our objective in keeping the cycle open and providing grant decisions within that 45-day turnaround was an effort to be more responsive. As we know, sometimes requests are time sensitive. At this point, I'd like to talk a little bit about the review criteria. Here are some criteria and typical questions to consider for capacity building grants. For a complete list of review criteria, please see the website. So some of the things that the review team considers is the degree to which applicant organizations' missions and visions align with KHF. Are anticipated outcomes clear, measurable, and reasonable? The extent to which the proposal describes how grant funding would help to develop stronger organizational capacity to make progress toward the applicant organization's vision and mission. What's the organization's past experience with similar efforts? To what extent would the grant funding help to develop stronger organizational capacity to make progress toward the applicant's vision and mission? Is the proposal, plan, and timeline sound and compelling? Here the review team is looking at the objectives and the goals of this work. What will be different because of this improved capacity? Let's look at the criteria and typical questions to consider for impact grants. To what extent does the proposal demonstrate a community need experienced as a barrier to health? Have you made a significant case using the data? Are proposed activities an innovative or promising approach? Is this a bold new innovative idea, or is this a project that was done before a few years ago but has been repackaged? Are the outcomes of the project clear, measurable, and reasonable? Does it seem reasonable that you can accomplish what's been outlined? Are the proposed strategies and implementation efforts on point? To what extent will this effort continue beyond the grant term? What's the game plan for continuing your efforts once you no longer have funding? And now I'd like to talk about how to apply. If you go to the main website, you'll find detailed information on the RFP and the online application link. If you're awarded a grant, at the end of the grant period, you'll have the opportunity to report on your accomplishments and how well you achieve the objectives through a grant status report. So it's a good idea to be tracking progress of the objectives outlined in the proposal. And then one final suggestion is to please review the Q&A section on our website prior to beginning your application. We continue to update this section as questions come in, and if you have further questions, please don't hesitate to reach out to us. Again, I'd like to thank you for your interest in the RFP and for joining the webinar today.